So just to say that when Sarah asked me, Katarina asked me to do this, I said, yeah, of course, I'll do that. And then I said, oh, gosh, I'm coming after Elena. So what can I say after Elena? So I decided to prepare well. And of course, after our first speaker just spoke about some of the things that keep me awake at night that are immensely important. So I decided to take a different angle here and look at behaviors and how the understanding of behaviors is so important for us to build resilience. Yeah, you're right. It's not a good thing, but I'm going to link it with people, so hopefully that will work. So extreme events. So extreme events are of different nature, but there are some characteristics that are common among them. So they are the timing, so we don't really know when they're going to occur. We don't know their nature, and we also can't really predict very well the impact that they're going to have. So it's very hard to prepare. It's even from an economic perspective not efficient to be prepared for extreme events because we're going to have idle capacity that we can't, we wouldn't use and will detract investment from other areas that we need when we have day-to-day business type of situation. So when they occur, they disrupt across several dimensions. Of course, increased morbidity and mortality, but there's spillover effects on a range of conditions that affect our health and well-being. They put a lot of strain on service delivery and health systems, but also they have a broader impact on society. So social and economic disruptions, and importantly, they exacerbate pre-existing health inequalities. Now, they also change our behaviors, and it's true that no one really cares much about the subtle behaviors, like how much we consume, and sometimes there are crises like the Gaza crisis in which we don't even care about that. It's about reacting to something that is so big and so large that the disruption is so large that we really need to react, be in reactive mode. But understanding behaviors is very important for the recovery from these events. Okay, so, and also for our preparedness, for our resilience of our ecosystems to recover from those events. So what I'm going to argue is not only focus just on health systems, because I think health systems in itself have very limited capacity to address the complexity of the impacts of these events, but broader systemic approaches to population health. So, and I'll take, of course, COVID, because most of the work we've been doing with the School of Public Health has been on that. So this audience doesn't need the first bit. There's a huge impact on health and well-being. We have seen, perhaps we have experienced the most severe capacity shortage in service provision in this country during the heat of the pandemic, but also it had a substantial economic impact. And the mechanisms for that economic impact are either associated with our behaviors, so our capacity to consume, our consumption behaviors. Remember the toilet paper. People do really behave in very different ways when they're facing these extreme shocks. But also due to regulations and mitigating strategies, for example, the new trade regulations, the business closures, traveling restrictions, and so on and so forth. Now, when you look at the impact, you all know that this hasn't really affected us equally. So we know that mortality and morbidity associated with COVID is varied across ethnic groups, across deprivation groups, but also the spillover effects on other conditions was also heterogeneous. So this is part of the work that we did here with the School of Public Health that looked at the spillover effects of the policies that we had during the pandemic on prioritizing COVID patients into hospital care and intensive care, disregarding that there was a whole set of other people, other patients that had other conditions and potentially should have been prioritized over COVID patients. And we found that many years of life could have been gained, in particular for patients with neoplasms, diseases of the digestive system. But we also know that these life years that we lost to some extent didn't affect all groups of the population in the same way. So the low-income groups and areas with a high proportion of ethnic minorities were more affected by these disruptions in care provision in areas beyond COVID. So COVID and the pandemic has impacted also a range of other behaviors. So come back into our behavior. So we know for example, behaviors like, diets, exercise, alcohol, smoking, that, are very important risk factors for a variety of other conditions that are, key drivers of mortality and morbidity globally, were highly affected, either because of psychological aspects associated with fear of the pandemic, but also due to restrictions imposed in the pandemic. And again, these behaviors have varied, but they haven't really affected equally the different subgroups of the population. So there is some variation in inequality in there. Some of these behaviors, have reverted to normal. So there's been a recent report saying, for example, obesity went up by 45% in children aged 4 to 5 during the pandemic, but that has now recovered to, business as usual levels. But for other groups, they still remain, and there will be important risk factors of disease. These shocks also impact other dimensions of our lives. So we know, for example, that the pandemic, and this is data for the US, impacted housing security, food insecurity, financial insecurity, unemployment, labor market outcomes, you name it. Every single dimension of our lives is affected. And also these impacts are unequal across the different subgroups of the population. So, for example, you have people from Black heritage, Black backgrounds being more affected in food insecurity, financial insecurity, as well as unemployment as a consequence of the pandemic. So what we're trying to depict is that there is heterogeneity in impacts of these shocks that give rise to inequalities, that aggravate already pre-existing inequalities. So there's these direct impacts of these events, and when we are reactive mode, we just tend to focus just on those direct health impacts of these extreme events. But then there's spillover effects on other conditions, on other areas of our health and well-being, but also there are social and economic consequences that, if not accounted for in a strategic way in terms of preparedness, but also in terms of recovery when these events occur, then they're in a cycle, the vicious cycle. They are going to keep on, the impacts on the population are going to endure over time. Now, when we start thinking, and again, this is a bit of a simplification for this group, but when we start thinking how can we best prepare for these events to ensure that there's no inequitable impact on the populations, and how can we, and to ensure also that we can recover at the same speed in a meaningful way for everybody in society, then it's important for us to consider the broader determinants of health. So even though common lay knowledge thinks that everything is explained by our genetics, our biology, and everything can, and all health impairment can actually be mitigated with medical care. That is what we try to focus on, these in the reactive mode of these extreme events. Actually, the vast majority of the determinants, 77.7%, actually relate to our individual behaviors, how they intersect with the environment, either the built environment or the natural environment, as well as our social economic circumstances. And these are important determinants of health, but also the very important determinants of the inequalities of health. So when we think how can we factor all these factors in preparedness, but also in recovery from these events, we really need to acknowledge that these are so many. There are so many drivers of health, determinants of health beyond health systems, and we are all that it's complex, and also we are very different, all of us, in the extent to which we are exposed in each point in time to these determinants. And so that's going to shape our behaviors. And when I mean behaviors, I mean not only the things we want to do from our own will, but the things that we are allowed to do given the context in which we live. And so there is heterogeneity in the factors that determine our decisions, our choices in health, but also in all other dimensions on our life. And those factors not only vary across people, they vary across areas, but also vary across time for each individual. So it becomes very complex to prepare and build resilient societies that can cope, but also can recover from these shocks. So, for example, if you think of vaccination, this is true in any type of behavior, and I do a lot of research on obesity because food behaviors are so complex, but it's also true in the context of infectious disease. So we know, for example, there are 110 factors at least associated with decisions of vaccination or not. And of course, this is compounded by the spillover effects and externalities that these behaviors generate on other people. So if you're trying to devise optimal policies, one of the things that it's extremely challenging. One of the things that always fascinates me working with modelers, epidemiologists, is that coverage, vaccination uptake and coverage rates are always a very high number and assumed to be fixed. But it's not. It will depend on the context. It might be high, hopefully high. So even when vaccines are available, people may or not uptake it for a variety of contextual reasons. Going back to the other type of behavior that I think is very important, so for example, wars disrupt supply chains and will have an impact on nutrition. Food insecurity was mentioned by our colleagues in the first talk. But so there's the complexity of factors. This is the obesity foresight map that highlights what are the factors, the drivers of obesity. To some extent, a lot of these factors impact also malnourishment. Of course, when we're business as usual, it's complex. When we are in, for example, in a war or in an emergency, some parts of these map are going to be a bit more salient and more urgent in reactive mode. But if you're thinking about longer term, for example, prevention of NCDs and how those were aggravated by infection, for example, during the pandemic, then we need to take into consideration this whole complexity. Okay, so what we need, so WHO framework to address inequalities really emphasizes the fact that we need to address those causes of causes, so not really just focus on downstream causes of disease and narrow interventions. So we need the causes of the causes. We need to factor not work in silos, as Elena was saying, and work at different levels: the micro, the meso, the policy levels, as even the global health level. So we need really to focus on the structural intermediate and as well the intermediate, but also the downstream factors. And we can't do that if we don't really have a sort of a health, policies approach or intersectoral action to make populations more resilient to the shocks, but also enable them to recover in equitable ways. And that really requires personalization of policies that address the complexities of the behaviors and the context of those behaviors, as well as policies and strategies to mitigate the differential impact that our responses, our health system responses have on populations. And when we look at research, so this really means that we really need to embrace this biopsychosocial model that is very important in preparedness and recovery. Maybe the biomedical model will be more important during the reactive phases of an extreme shock like a war or a pandemic. But for the preparedness and the recovery, the biopsychosocial model is important. And we know that even though it has been first alluded to in the 19th century and then the term coined in 1977, when we look at research, and this is research in my area in health economics and policy, the uptake of that approach to population health has been quite slow over the years. Here you have some Google searches using that term that, again, you see that it picked up after the social determinants of health by Marmot report came up, but we still don't really do much about prevention and health promotion modules to build resilience in the populations to recover from these shocks, embracing these broader determinants of health. Now, the reason why we don't do it is because it's quite complex, right? So we have that human behaviors and risk factors are complex to model and to change. They are dynamic. There's an intertwined nature of those behaviors. So, for example, think about consumption, labor market participation, even meditation and health-seeking behaviors. They all go hand in hand. There's the complexity of these contextual influences. The exposure to these behavior-shaping factors vary spatially and temporally. They may generate externalities and spillover effects on other parts of society, making it a bit more complicated to assess not only the drivers of the behaviors, but also the effectiveness of different strategies to mitigate them. And there are also these pervasive feedback and spillover mechanisms of policies in one area aggravating situations in other areas. So the complexity tends to be disregarded in modeling, the modeling that we do, and also in interventions and policy. So we end up really with weak tools to engineer behaviors. So during the pandemic, that was really highlighted with the things that we saw in terms of mitigation strategies. So we had mitigating strategies that had differential effectiveness across the different subgroups of the populations, and some actually others that had actually negative impacts. So here is some of the research that we did with Katerina. We're looking at the impact of NPIs and lockdowns on mobility, and we see that the poor couldn't shield as much as the rich, nor the non-white. So they couldn't stay at home working from the Zooms and their fancy laptops. They had to go to work, or they had to decide between their livelihoods and being exposed to risks. This is another example of a policy that disregarded really the broader psychological and political factors associated with our behaviors and our response to the mitigating strategies. So this is, again, the US, where we look at the employment-based vaccination mandates, and actually what we see is that there was a lot of psychological reactance, and those mandates actually far back. So the vaccination uptake actually declined. We also have policies that don't really factor and continue to have, not only during the pandemic, but in general, that health vulnerability, of course, is important, but that goes hand in hand with behavioral vulnerability and socioeconomic variability. So if you disregard these broader social determinants and more structural determinants of behaviors and of health, then we end up with policies that really aggravate, don't really fix these inequitable impacts on the population. So we really need to have more policies that consider vulnerability at all levels. And we need to consider that those impacts on population, those drivers of the behaviors and the drivers of the health and economic vulnerability are complex, and the exposure to them varies across time and groups of the population. So we really need to start moving towards not one-size-fits-all type of interventions that are very popular in most systems, especially in the context of public health, but more to personalized and adaptive interventions. And last but not least, we can't forget that there's a vicious cycle. So this interlinkage between behaviors and health and economy, on health and society and the economy, needs really to be factored into policy. So we know that health impacts economic behaviors shape the economy and society, and then these shape the social economic determinant, the broader determinants of health, and again, shape health, and so on and so forth. So we need really these whole of society and whole of government's approach, so this collaboration, not working in silos, not only within health systems, but also a bit more broadly within all other parts of the economy. And for that, coming back to research, and this is my last slide, we need better evidence, we need better research, and we need better infrastructure. So one of the things that I think we really need is behavioral surveillance. So one of the things that we got asked the most during the pandemic was, what would happen in an unmitigated pandemic? And we don't know. Unfortunately, we don't know. And we can't even now assess retrospectively, because we didn't really map thoroughly people's behaviors and the drivers of those behaviors during the pandemic. So we really need behavioral surveillance, making use of sensing to get smart data that is triangulated, so assesses where the behaviors in the context of those behaviors, where people are, their interactions with other people, so we can start characterizing this complexity of social, economic, and health behaviors as well as their drivers. These need to be to some frequency. I love high frequency and real time, or real time as much as we can, so that then we can use these data to have better integrated modeling, so integrating economic and epidemiological modeling like Jamil has been doing, but also microfound those models to better characterize heterogeneities of behavior within each, for example, of the compartments. And then use that data to actually develop, and perhaps even if data is to sufficient scale and it's rich enough, test in silico policies and interventions, and optimize on those interventions, deploy them in the field, and then recapture through, for example, sensing and making use of digital technologies, the feedback impacts, so the spillover effects of those interventions, and then continuously feeding this modeling and this adaptation of policies over time, so that we can really have not only effective policies, but also policies that promote equitable recovery after these events. And that's it. Thank you.